One, ignition. Right away, Houston.
As the fourth industrial revolution looms on the horizon, a new religion emerges, that of scientism. Masquerading as materialists and atheists, the prophets of this new creed cry out in the town square of the coming age of transhumanism, when man will finally become like gods.
When Yuval Noah Harari published his first book, Sapiens, in 2014, about the history of the human species, it became a global bestseller, and turned the little-known Israeli history professor into one of the most popular writers and thinkers on the planet. But when we met with Harari in Tel Aviv this summer, it wasn't our species' past that concerned him. It was our future.
Life is about to break out of the limited organic realm and start spreading into the vastness of the inorganic realm. We are about to create the first inorganic life forms after 4 billion years of evolution. And in the process, our own species, Homo sapiens, is likely to disappear, not because we will destroy ourselves, but because we will change and upgrade ourselves into something very different.
In the 21st century will be to try and gain control of the world inside us, to learn how to engineer and produce our bodies and brains and minds. These are likely to be the main products of the 21st century economy. In the coming decades, AI and biotechnology will give us godlike abilities to re-engineer life and even to create completely new life forms. Then the big political and economic question of the 21st century will be, what do we need humans for? Or at least, what do we need so many humans for?
Do you have an answer in the book?
At present, the best guess we have is keep them happy with drugs and computer games. But this doesn't sound like a very appealing future.
Ray Kurzweil is one of the world's leading inventors, thinkers and futurists, with a 30-year track and reputation of accurate predictions. Called the Restless Genius by the Wall Street Journal and the Ultimate Thinking Machine by Forbes, he was selected as one of the top entrepreneurs by Inc. magazine, which described him as the rightful heir to Thomas Edison. PBS selected him as one of the 16 revolutionaries who made America.
It's the exponentially growing information technologies that will save us in the form of GNR, genetics, nanotechnology, robotics. Robotics really meaning artificial intelligence. There's been a long tradition in science, ever since Copernicus replaced Ptolemy, that there's nothing special about humans, there's nothing special about the earth. We're not descended from gods, we're descended from worms.
We are fundamentally information. At the core of every one of our 10 trillion cells are genes, and genes are sequences of data. And they evolved thousands of years ago. Many of them go back millions of years. We have this old software that really is not entirely relevant to the modern age we live in.
Well, we're going to become increasingly non-biological to the point where the non-biological part predominates and the biological part is not that important anymore. In fact, the non-biological part, the machine part, will be so powerful it can completely model and understand the biological part. So even if that biological part went away, it wouldn't make any difference because the non-biological part already understood it completely.
Another step then is in the 2030s, when we can actually connect our neocortex, which is where we do our thinking, to computers. So I believe that will happen in the 2030s. We will actually, so just the way this is greatly amplified by being connected to the cloud, we can connect our own brain to the cloud.
To clarify what I think you just said, that in 20 years, plus or minus, so the mid-2030s, we will have nanobots that we can feed into our brain that directly connect to the cloud rather than through anything we carry in our pocket.
Elon Musk's brain implant company Neuralink said on Thursday it had been given a green light from the US FDA to kickstart its first-in-human clinical study.
The bottom line is we are one human-machine civilization. This technology has already expanded who we are and is going to go into high gear when we get to the steep part of the exponential.
And then the last revolution, which began about 500 years ago, and which we are still really just in the beginning of it, is the scientific revolution. Again, humankind gains immense new powers, such big powers that you can say they might really transform us, not only from just apes into the rulers of the planet, they might transform us into gods.
We are in the midst of the fourth industrial revolution, which accelerates global change in much more comprehensive and faster ways than the previous three revolutions.
The difference of this fourth industrial revolution is it doesn't change what you are doing. It changes you. If you take genetic editing, just as an example.
On va les implanter dans nos vêtements, c'est-à-dire wearables, comme on le dit. Et après, on pourrait s'imaginer qu'on les implante dans nos cerveaux ou dans notre peau. Et à la fin, peut-être il y a une communication directe entre notre cerveau et le monde digital. Ce que nous voyons, c'est une sorte de fusion du monde physique, digital et biologique.
So we had these two big revolutions, the computer science revolution, or the infotech revolution, and the revolution in the biological sciences. And they are still separate, but they are about to merge. They are merging around, I would say, the biometric sensor.
This is where authority in the 21st century will reside, and all the important decisions will not be made by the Pope or by God. They will not be made by democratic elections and by individual consumers. They will be made by the algorithms in the cloud. Biotechnology will, for the first time in history, translate economic inequality into biological inequality. Therefore may even push humans out of the job market and will create an immense new class, the useless class.
In the medical marketing industry, we have experts dedicated to something called nomenclature, which is making up words or changing the definition of words so that it sounds better to the medical audience and to consumers. And mRNA is a misnomer. The term mRNA vaccine is a red herring. The purpose is to manipulate people into believing that they are being injected with something that is biological in nature and that is going to enhance their immune system. And that's simply not true. The point of this was to end the human species, to create a new, as Elon Musk calls them, humanoids, like to merge technology into the human body. And before people say that's crazy, what do you think biotechnology is?
DARPA calls it transhumanism, military transhumanism. But in an interesting way, this is actually part and parcel of the whole movement towards robotics. It's not only making individual warfighters comfortable with robots, it's this idea of coupling man and machine and merging humans and machine. And DARPA is doing that with programs now with what they call biohybrids, which people might call cyborgs. You know, they are able to actually control a rat through a labyrinth remotely because they've implanted electrodes in its brain.
This is a developmental system made by MC10, and it has an antenna and some sensors embedded in it. And what we plan to do is work with them to advance a tattoo that could be used for authentication.
It's taking biology and making it technology, taking technology and making it biology. And transhumanism is the merger of the human body with technology. It's obvious to me. I don't know what people, like, the words mean what they mean.
We are at the beginning. When you look at it, at technology transformation, it usually takes place in the terms of an S-curve. And we are just now where we move into the exponential phase. And I agree. artificial intelligence, but not only artificial intelligence, but also the metaverse, new space technologies, and I could go on and on, synthetic biology. Our life in 10 years from now will be completely different, very much affected, and who masters those technologies in some way will be the master of the world.
So people often ask me, so do you think COVID-19 never happened? And COVID-19 absolutely did happen. There was a pandemic, but what caused COVID-19 was not a virus. What it was this lipid nanoparticle technology that basically hijacks the human immune system as well as our neurological system, causing mild to moderate disease or severe disease. So what they were calling spike proteins were actually lipid nanoparticles. Those were LNPs. When you take a magnetic hydrogel, which is also in the patents, and you infect a biological cell, you can see that cell is covered with all of these little spikes. That's the spike protein. You're not infected with a virus, you're infected with lipid nanoparticle technology that then reprograms that cell to then give off these biosynthetic toxins in your body. That's what caused COVID-19. And James Giordano, who began advising the US military and the intelligence community in 2008 under the Obama administration, actually discusses the use of lipid nanoparticle technology as neuroweapons.
7 months before the allegation of patient number 1, 4 patent applications of Moderna were modified to include the term accidental or intentional release of a respiratory pathogen as the justification for making a vaccine for a thing that did not exist.
So let's just get into this, and I'd like to take you through the patents that are on Moderna's website. So there's a patent entitled Modified Polynucleotides for the Production of Secreted Proteins. This is one of the master patents for what they're calling mRNA vaccines. Right in the abstract, it describes that the lipid nanoparticles have a particle size between 80 and 160 nanometers, and it contains modified mRNA encoding a polypeptide. It includes a cationic lipid, a neutral lipid, a cholesterol, and a pegylated lipid. What they're calling lipids actually host cationic charges. They host positive electromagnetic fields. There is no lipid in nature that does that. They're using the term lipid instead of nanotechnology. As you go through the patent in section 219, it explains how they are self-assembled nanoparticles and they're fully programmable. That term in here is an alarming term for a number of reasons. One reason is that these are both pre-programmable as well as they can receive programs from an external source. Microsoft did a 3-minute video on their technology. They call them biological computers.
Imagine a world where we can do computation inside living cells.
The problem that we're trying to solve is really trying to have a more sophisticated diagnosis that can happen automatically inside cells.
Imagine a biological computer that operates inside a living cell.
The type of work that they're doing is essentially they're trying to sense, analyze and control molecular information.
In this project, we're trying to use DNA as a programmable material.
DNA is highly programmable, just like a computer, and we can program a whole range of complex behaviors using DNA molecules.
So there's one specific patent that I think it's very important for every American citizen to see, and it's patent number US 9539210B2. It was issued on January 10th of 2017. The patent is entitled Vaccine Nanotechnology, and in section 9 it discusses the vaccine nanotechnology that can deliver molecules. In some embodiments, the small molecule is a toxin. The toxin is from a chemical weapon, an agent of biowarfare. This is a utility patent for the pegylated lipid nanoparticles that are in these, what they're calling COVID-19 vaccines. It is a utility patent for that nanotechnology to be used as a bioweapon. So Pfizer entered into a contract with the Department of Defense, the US Army, in July of 2020. And the contract was to manufacture a vaccine that was capable of providing protection against the SARS-CoV-2 threat and related coronaviruses. So the purpose was to create an mRNA vaccine that would protect against SARS-CoV-2 infection and the variants. As you go through this contract, though, under the Chemistry Manufacturing Control section, they go through the manufacturing process. Much of it is blacked out for the lipid nanoparticle formulation. They discuss how the lipid nanoparticles must adhere to good manufacturing practices, so they must not be contaminated. Well, in 2017, the FDA published guidance called Classification of Products as Drugs and Devices. And they classify nanoparticles. They classify them as devices because they can perform their functions inside the human body without being dependent on chemical reactions inside the human body. As you continue to go through the contract under the manufacturing development plan, that Pfizer will describe the manufacturing process for the vaccine product to ensure conformity with the Food and Drug Consumer Protection Act Title 21, 351 A2B. That's alarming because 21 U.S. Code 351 A2B is the good manufacturing processes for devices. Specifically, the term device is an instrument, an apparatus, machine, or a contrivance that is intended to affect the structure of any function of the body of a man or other animal and does not achieve its primary purpose through chemical action within the body. So Pfizer has to adhere to the manufacturing practices for electromagnetic devices in their Operation Warp Speed contract. Nobody was told they were injected with electromagnetic devices. My first interview with Stu Peters, I disclosed the manufacturing facilities in China that were creating all of the excipients for all of the COVID-19 injections around the globe, including Pfizer's ALC0135 and ALC0159. And when you went to their website and you looked at their formulation for these excipients, they had publications on there explaining how they contained graphene oxide. And although that interview has gotten well over tens of millions of views around the globe, I was immediately attacked by the mainstream media saying that there was no evidence that there was graphene oxide in the injections. We are being gaslit and being told that there is no nanotechnology and there is no graphene oxide in these injections. Pfizer's own internal documents, and they have a peer-reviewed publication explaining how they use graphene oxide in the engineering of these nanoparticle technologies and their spike proteins. And when you read through the document, they explain how they order sequences from Syn Biological, infect human embryonic kidney cells, pour that fluid, that purified protein fluid, because now after they infect the human embryonic kidney cells, those kidney cells produce these new multi-species proteins that have genetic sequences from non-human DNA. They pour it over a gold quantifoil mesh grids and overlay it with 1 atom thick layer of graphene oxide. They create electromagnetic fields that then disrupt the electrons of all of these materials, both organic and inorganic, and new ionic bonds are created. Those new ionic bonds then create millions of what they're calling spike proteins, which are these new artificial pathogens. Scientists and doctors around the globe have started to take a look at what's in the vials underneath the microscope, and Dr. Anna Mahalsia out of Washington State has been pioneering an effort to do this globally, and her colleagues have found and observed electromagnetic devices underneath the microscope, and they've seen the technology begin to self-assemble. Engineers have been looking at the vials, the fluid in the vials underneath an electron microscope, brought in cell phones to see if there's a reaction. And what they found is that when the fluid that's in the vials is near electromagnetic frequencies, whether they're from smartphones or smart towers in a house, it activates this technology. They also talk about in this patent, section 219, is the gels and the hydrogels. And it says, mRNA disclosed herein may be encapsulated into any hydrogel known in the art, which may form a gel when injected into the subject. And hydrogel is comprised of single atom thick graphene oxides. So in Died Suddenly, when you see those long, thin, white, fibrous clots, those are the product of magnetic smart hydrogel. They're called soft actuators. They mimic cells and proteins to the point that they can actually start building structures in the human body, tissue structures, anatomical structures. They can recreate entire systems and organs. And hydrogel is comprised of single atom thick graphene oxide. What you're also going to be seeing, though, is you're going to be hearing the benefits of graphene oxide. The mainstream media is going to say, oh, graphene oxide has these amazing bactericidal effects, meaning it kills bacteria. It has amazing antiviral effects. These are things that you're going to hear about graphene oxide. These are lies. Graphene oxide can be as thin as a single atom thick. But it's also a great conductor of electromagnetic fields. When it's been merged with these non-human proteins that Pfizer did in Groton, Connecticut, and they merged graphene oxide, an electromagnetic conductor, with proteins, biological proteins, and they create these new synthetic agents, they're called transducers. That means they can change the electromagnetic field inside the human body. Graphene oxide is being used because of its great electromagnetic properties. This is not conspiracy theory, and people are hosting electromagnetic fields. We have people who are able to put magnets to themselves. They're emitting Bluetooth signals. mRNA is software programs. It is encoding. And if you go to Moderna's website in the Wayback Machine from 2021, they specifically say on their website, mRNA is a temporary set of instructions for cells to make a protein. They call DNA the storage of that, and they call their mRNA platform an operating system. Under 21 USC 351, which is cited in the Operation Warp Speed contract, when they discuss devices, they also discuss the software programs. It says the term device does not include software functions excluded pursuant to section 360JO of this title. So Moderna says on their website that the mRNA are software programs, and they can be programmed, pre-programmed, or they can be programmed from outside sources. Operation Warp Speed contract and the FDA are saying they're not overseeing what these programs do. So in the very near future, you're going to be hearing this new term, directed evolution.
No, directed evolution is very different.
Direct evolution?
Directed evolution.
Directed evolution, okay. Well, so, I mean, is that what it is?
Maybe, well, you're not supposed to do gain function research with the viruses, like, they recommend not. But you do, like, these, like, selected directional mutations to try to see if you can make more potent.
Yeah.
So there is research ongoing about that. I don't know how that's going to work. There better not be any more outbreaks, because, like, Jesus Christ.
But they're not talking about viruses. They're talking about the directed evolution and controlling the evolution of the human species. Directed evolution is transhumanism. Transhumanism, if you're forcing non-human genetic mutations to our genome, you are exterminating the human species.
It was actually described as a bioweapons platform technology in 2005. And from 2005 onwards, it was actually a biowarfare enabling agent, its official classification from 2005 forward. I don't know if that sounds like public health to you. Does it? Biological warfare enabling technology. That feels like not public health. That feels like not medicine. That feels like a weapon designed to take out humanity. That's what it feels like. And it feels like that because that's exactly what it is.
directed evolution is for the purposes of exterminating the human species. It is the definition of biowarfare.
Because of their lust for power, the rulers of this world are doomed to reenact their fathers' sins. In the days of Noah, they contaminated the gene pool. But today, their hubris has augmented the very fabric of God's handiwork.
That on a historical timescale, we are very close to an unprecedented and enormous and swift transformation of human life and the world.
20 years from now, they will be the size of blood cells and you won't need any surgery. It'll just go into your brain through the bloodstream. Little robotic devices in the bloodstream, into the brain, and they'll put our neocortex, which is the part of our brain where we do our thinking, onto the cloud, connected to the cloud.
Today, it's the beginning of a global mobilization effort to rally all forces behind this great reset initiative.
In their hubris, the builders of the Tower of Babel reached toward the sky to make war on heaven and overthrow God. And nothing that they had imagined would be restrained from them, so God confused their languages. But today, the builders of these new towers care not on whom they make war, as long as they become like the God they claim does not exist. But if history has clarified anything, it is that the minds responsible for bringing forth these technological revolutions will soon regret what they have done. But by then, it will be far too late. Pandora's box is now open, and its contents have exploded forth into this world under the influence of those men and spirits who despise themselves and their maker.